Hi everyone. This is this week's live video, and I just wanted to talk a little bit about, we've talked about fatigue and we talked about anxiety, but I think it's appropriate this week to talk about depression, since that seems to be something that we need to look at a little bit more in this country and consider that a health issue. It's a crisis, really. And because depression affects women more, I think it's very appropriate that we talk about it here when we're trying to help women empower themselves with their health, and especially women leaders. So it might surprise us that no matter how much success that we have, there's always these struggles that are going on. And I think it hit us all emotionally this week with what's been happening. So I wanted to talk a little bit about the causes of depression, and to relate that it's not just about the way you think and the way you feel. There are actually biochemical things that can be addressed. So no matter how dark a place that we find ourselves, there's always something you can do about it. And I want to try to spread the message out there that there are some things that probably have been missed, and that there's always, I want to help be a resource for women, because I have seen so many transformations with people who are struggling with depression, especially women. So for me, I wanted to talk about, the causes of depression, and in the hopes that it can make a little bit of sense. And if any of you are struggling with this, I want you to, private message us through here, or reach out to me some way. You can comment even if you feel okay doing that. So the causes of depression, we have genetics. Okay, so there's actually a genetic issue that has come to light a little bit more recently with a gene that's a folic acid gene. So when you have in your family, if you've got depression in your family, oftentimes it can actually be a really simple, thing that you can address if you just know what to look for. So there's a genetic component to depression. Hormones, of course. So hormones have a lot to do with our mood. I've spoken before about how estrogen is related to serotonin, and progesterone is related to GABA. So our hormones are very much connected to our depression and anxiety. Thyroid hormone also. So thyroid is something that's very undertreated in this country, and I feel really strongly about that, because there's, even the American Association of Endocrinologists changed the ranges that we look at as for healthy thyroid function many years ago. I think it was in 2003, but it's not been adopted yet. So thyroid issues, even if you're on thyroid medication and I think it's worthwhile to get that checked out and get it refined by someone who really knows what they're doing. Seasonal affective disorder, that's a big thing. So for people who live in northern climates, they, in the winter times, you get SAD, and that's really due to the lack of light. And I mean, from what I've seen is when you're in the presence of darkness, you stop producing, you overproduce melatonin, and then in light, melatonin gets shut down. So your circadian rhythm is why seasonal affective disorder happens. And it's something that can be addressed as part of a whole program, but oftentimes many people have had help with that by doing a light, full spectrum light or a light box. So that can be, we actually test all of our patients for melatonin levels in the morning and in the evening, because we want to see if they're having sleep issues or if they're having depression, then we want to be able to see what is at the root of it. So also nutrition. So even if you think you eat a healthy diet, this can be an issue. So I want to tell a little bit of a short story here. I'm a naturopathic doctor. I'm not perfect, but I do feel like I feed myself well. I have I was kind of pescatarian, eat lots of fruits and vegetables, good sources of protein. And I recently was diagnosed with a pretty bad anemia. And guess what I had? Fatigue and depression. So these are things that if we cover all the bases and we look at all the causes and we correct those, it's really not a hopeless cause. I mean, if anyone takes away anything from today's Facebook Live, is that there are things that we can look at and do about it. It's not all in your head. So nutrition is a big one. And then finally, the biggest thing I want to talk about or add to the list is stress. And the reason why we want to talk about stress is because stress actually can cause all the things we talked about, except for the genetic issue. But stress can actually impact your nutritional status, because when you are in stress, you're not digesting your food as well. It actually can cause seasonal affective disorder, because it actually does affect your circadian rhythm. So when I test people's hormones to gauge how stress is affecting their body, oftentimes they're actually they're deficient in melatonin at night, and then they have too much in the morning, and it's the opposite of what it should be. And then stress, of course, affects hormones. So as women, the stress happens, and it actually affects our ability to make progesterone. We become estrogen dominant, and actually later on down with long-term stress, we become estrogen and testosterone deficient as well. And those are directly linked to depression. So I think that, I really just want to put the message out there that if any of this sounds like it could be you or a friend, make sure that, you're getting the right help that will cover all of these bases. What about hormones? What about nutritional, your iron status? What about your vitamin D level? There's a lot of things that are at play here that really make a huge difference. And I actually had a patient who I treated in 3 to 5 days into her treatment. She had 20 years of depression and chronic fatigue, and had a basic miraculous recovery from that, from just looking at adrenal health. So this is kind of the foundation of the Empowered Women's Health Project, and it's really it really hit home for me this week. And I want everyone to know that you can get help with hormones and nutritional status and these things that most doctors don't look at. So anyways, I hope that you got something out of today, and please message me or comment below if you or a friend needs support in any way. And I'm going to put in the comment the National Suicide Prevention Lifeline, just to have another resource out there for people. And until next week, have a great week, everyone. Thanks for watching.